Well, hello. This is Dr. Isabelle Amigues, and welcome to the UnabridgedMD Podcast. Here we explore inspiring stories, practical tools, and expert insights for living a healthy life. Whether you're a patient, a healthcare professional, or simply curious about healing, you are in the right place. And as always, if you are looking for something that's so much bigger than just a rheumatology practice, please come check UnabridgedMD, as we are the right place to get you to remission with the least amount of medication. With that said, let's dive in.
Welcome back to the podcast, y'all. Am I sounding good? I noticed my mic was a little low. I'm here with Dr. Isabelle, and it seems like you know the producer here, Yovel.
I do, yeah.
Do you work with Yovel as
Yes,
well?
I
Okay,
do, yeah.
you do. So, okay, awesome. Yovel, thank you for the connection once again. And this is episode 199.
Nice.
I'm excited to see what synchronicities lie ahead. But you were curious about my products.
Mm-hmm.
And I was like, well, you were asking me, do I advertise on the show for the products? And I usually do organically by gifting my guest what I imagine they might like. So these are gifts for you.
Oh, sweet.
You
didn't share this with me before.
Yeah, so now it's more of a surprise. I used a little bit of this prior on my face, but that's what this is. This is a tallow balm made from bison kidney fat.
Okay.
Have you ever used tallow?
No.
Okay, well, most people say it's the best skin moisturizer they've ever used, and people in the hospital specifically, they were constantly scrubbed that have dry skin and or dishwashers. I've heard this is the only thing that like works this well. So it's bison kidney fat with a little organic emu oil and organic cacao and vanilla. And you can smell it if you would like, but this is a gift for you. This is our best-selling one skin product. We have a few different flavors, but I just put it everywhere.
On your face.
Everywhere. On my armpits and my hair, everywhere.
I put it on my hands.
It's edible. So
And
it's all edible
That's
ingredients.
So cool.
So that's for you. And that's our Yovel's one of his favorites.
I love that.
He actually popped on the podcast last time and then just went crazy talking about how it's the best thing for him in Colorado. We're pretty high and dry up here.
We are. I'm always constantly dry, so this is great. Look at that. Ding.
And then this one right here, if you want to read the bottle, I mean, I'm curious to see what
elk antler, liver and heart. What is that?
So we freeze dry the organs of the American elk raw. The liver and the heart are raw, freeze dried from wild elk in Texas. And then we get the antler when it's in the growth state, the velvet state. Do you know what I'm talking about with when deer and they have the velvet so that's the fastest growing organic material on a mammal in the world. So there's growth factor in there and all kinds of other things like glucosamine and a lot of other micronutrients people take supplements for. So they clip those antlers when they're in the peak growth state, and then we freeze dry that raw, and that's a combination of those three products.
That's very cool. Okay. So are you a hunter?
I have hunted.
Okay.
Yes.
Do you have to hunt them or?
So the elk in Texas, where the liver and heart are coming from private ranches that have too many elk. And what they do is they go out with an inspector on site and sharpshooters and spotlights. So they they go out and they have silencers and they shoot the elk in the head and it drops.
Okay.
No torturing. These are wild elk that are arguably being taken down in the most humane way.
No, that's cool. Yeah. No.
But I don't know if you're familiar with these because here my guest, Dr. Isabelle, is a doctor here, and you work here in Boulder, the Front Range.
Yeah, Boulder and Denver. I'm mostly in Denver, and I just started in Boulder.
And you work in rheumatology, and that includes like joint issues, correct? Yeah,
joint inflammation.
Okay. Yeah. So the antler specifically, I'm not sure if you've ever heard of this, but like one of my suppliers, for instance, he had elk and he had antlers, and one of his friend's dogs couldn't walk anymore. They was like old and had a hip issue, and he started feeding the antlers in that velvet state to the dog, and the dog all of a sudden was running again. And it turns out this is what this has been used in Chinese medicine for thousands of years, that something about the antler is really good for joint issues.
Okay, I mean, you said glucosamine, right?
Yeah, so it's loaded, and it's like the cartilage and that blood that is making the antlers grow so fast with the growth factor.
Yeah.
So that's what people use it for, that and libido.
Okay.
The word horny came from Like that's where
Really?
yeah.
That actually makes sense.
Yeah, because they're in their rut.
That makes total sense.
Yeah. So that if you want to try that, that was just the bottle that I was using. It's great before a workout. So I play pickleball, and when I play, sometimes I notice my knees and joints. And if I take that prior, I feel like much stronger and it's almost like my joints are lubricated.
Okay.
And the liver and the heart have every micronutrient that people take a supplement for, including like B12, CoQ10, heme iron. So a lot of women use that for their iron levels.
Okay. And that's super interesting.
Yeah. So that's, you asked, and that's how we're starting this Breaking Normal podcast. Tribevitamins.com is like the official sponsor of this show.
That's really
since
cool.
I founded this company.
Okay.
Yeah.
That's really cool, actually. I'm going to definitely look at this. The growth hormone, I'm always a little bit afraid of it because I've got a history of cancer.
My dad as well, and he was concerned about the same thing.
Oh, really?
And
Okay.
I agree. Like my dad's been a pharmacist for over 45 years,
Yeah.
and it looks like he overcame bladder cancer.
Okay, nice.
Recently, and he's definitely concerned about anything exogenous hormone wise, but I would be much more concerned if it was anything like pharmaceutical or lab made or
Of course.
injected. Since this is just a food, I think it's one of the safest,
safer.
but I would never push that on anybody,
No, of
especially
course,
that has gone through.
Yeah.
What happened with you in that?
Breast cancer, 40th gift, 40th year gift.
When you were 40 years.
Yeah, exactly. 40 years and 2 weeks. That was my gift.
Okay.
And it really was a gift. Yeah.
I thought you could have been younger than 40. How long ago was that?
I don't think this, actually. It was, 6 years ago now?
Wow.
Yeah.
Well, you look extremely healthy and vibrant.
Yeah, now I am. Yeah, because it was a gift. Yeah.
So can you describe to us what you mean by that being a gift?
So, I don't know. Yeah, that's pretty personal. And you were talking about authenticity, and I guess I always put vulnerability with authenticity. So I had the most cliche thing that can happen, which is like I had a midlife crisis at 40, a little bit before 40 actually, like maybe 1 month before my 40th birthday. I had a midlife crisis of what am I doing? So I was a physician at a very good institution doing research, married, 2 kids, and on paper it looked really amazing, and I had to work for that. And then suddenly I'm like, this is awful. I'm super unhappy. This is not what I want. I don't even know what I want. And I remember talking to my, so I come from France, and I reached out to my French friends, and I was like, I'm such a cliche. And one of my very good friends was like, well, there's a reason why cliche is called like that, is that it's pretty common. So you should not feel guilty about being common. And I was getting out of my midlife crisis by thinking I'm going to divorce. When I saw a big mass on my breast. And
so the divorce, you said you were going to...
I was going to divorce.
You were going to divorce.
I mean, I was thinking of divorcing.
Okay.
And like anything like that, it takes a while to decide.
Okay.
The end of the story is after I was diagnosed, and after I went into remission, I actually decided that, we've tried everything, including a cancer. So, we're very good friends, but we're divorced.
Wow.
And it's actually, it's a funny story because I had decided that I was going to France as a gift to myself. And I saw the mass on a Saturday. I got it biopsied on Tuesday, and I still went on a Wednesday to France. Or was it Tuesday night? I went after the biopsy to France, and I got my diagnosis in France, surrounded by my friends, family, and instead of being sad, one of my friends started just laughing at me and just like, oh, look at you. You're not doing a regular midlife crisis. You're not cliche anymore. And I'm like, oh no,
Wow.
What did I do?
Wow.
So yeah, and that changed. I was telling you, it's a gift that changed my life for the better, honestly. Someone told me that I bought my freedom at a high price, and I remember telling him, no, not a high price. And then I was like, hold on, it was a high price, but it was so worth it. So yeah.
Wow. I mean, I want to understand more. So, the divorce? Did you divorce after going through the remission? Like, you had the idea of
Yeah,
divorcing, then you found that you had cancer, and then you went through that
yeah,
and
I went.
healed through that, and then divorced.
Yeah, yeah,
Wow.
pretty much. Yeah,
Wow.
we tried. I mean, we tried everything. You know what? It's kind of, I'm not a quitter, and my ex-husband is not a quitter, and basically we're like, we're gonna try it all. We're gonna try everything, and so we went to many therapists, and we tried a lot, and ultimately we had grown apart. And so, yeah, we divorced. And the judge that signed the paper was like, "Wow, are you sure?" Because we actually get along.
Was this in France or
No,
was
no,
this
it's
in?
here. Yeah, it's here.
Okay.
And he's the reason I came to the US. Yeah,
So he's
yeah.
American.
Indian. I met him in India, and he was coming to the US.
Wow.
I know, right? Like the word is so
India,
smart.
like
So I met him in India. He's Indian. He's the
wow.
smartest physician I've ever met.
Wow. What kind of physician is he?
He's a nephrologist, a kidney doctor. Yeah,
Wow.
he's super,
Does he
super
practice
smart.
here as well? Wow.
Yeah,
Wow. Okay.
yeah, and that's the thing, right? It's when you're realizing that you only have one life, and your life is actually pretty short. And it was stage 4, so I had.
When you got the diagnosis, it was
Yeah, there was metastasis to the liver and the bone. So this time I was like, okay, you've got my attention. I'm listening. What's going on? I didn't know if I was going to make it. And when you're so close to death, I think you're a lot more authentic. You don't care about the ego. It's not about the ego. Like, you realize the ego is useless. Like, I don't know how to explain. Like, it was just this realization of like, I don't care what people think or don't think of me. I don't like,
that just
that's
all
not what's
fell away.
important. And suddenly you're so loving. I mean, I don't know for everyone, but suddenly I was much more loving. So even now, my ex-husband, I was really angry at him before. And suddenly I was like, man, like, we're all trying our best for this life.
And this was through you healing.
Yeah, this was through and I think it was part of the healing of what am I here for? What do I want? Like, I don't know how much time I have. What do I want with the time I have? And a big thing was I want love, and I want love from my partner, either with my husband, either with someone else, and I want love from my kids because I felt very disconnected from my kids.
How old were your kids at
They
that
were
time?
3 years old. I have twins.
Oh, wow.
Yeah,
Okay.
yeah. And it's probably
Like
all,
boy, girl, or
yeah, boy and girl.
oh,
Yeah,
wow. Okay.
yeah, yeah. That's the funny part, right? Like, so we are just, discussing this, but what's really interesting is when you start like realizing that everyone has a story, and probably many stories also. So I started doing a podcast, and at one point I was like wondering, I was like, oh, maybe I should stop because it's taking me a lot of time. And I was like, no, 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 no. I love meeting people and having this excuse of asking them questions that are super deep that you would not necessarily do on a first time basis, right? And yeah, there's this realization of, man, like, people are so cool, so
Totally one of the reasons I'm sitting here right now,
yeah,
and very happy about sitting here.
yeah.
How long were you and your husband together?
14 years.
14. So when you were 40,
Yeah.
how long was that?
So that was 6 years ago. So wow, it would have been. You see, time flies
I
because
know,
it would have
since
been
2020.
20. Yeah, yeah, time flies. Yeah, we just, we were good, and then we were just not good.
So how many years was that at 2020?
So I don't know. When did I meet him? I met him in 2003 in India.
Okay.
And
okay.
then,
when did y'all get married?
We got married in 2011. Wow, you're going to
okay.
know everything.
Okay.
I moved to the US for good in 2011. I had tried before to come here. I did like a little bit of research in New York City. And yeah, I mean, I think we live so long now that you can't, like, it's really cool when someone, like, when you're looking at those couples that last for long, and you're like, yeah, that's wonderful. But I think they have to reinvent themselves. I was talking to a shaman. I'm very interested in all of this, things that are very healing and
Did
energy and all.
shamanism come before 40 or during the healing?
After 40, actually. Yeah.
After
Oh man,
after
during this whole healing journey,
during the
shaman.
healing
Yeah, because I was
journey.
like, well, I
Okay.
want the power of placebo on my side. That's 30% right there. So from a scientific perspective, so I'm very evidence-based medicine. I've been trained like that. I've done 2 trainings, one in France, one in the US. I've done a ton of research. I've, published many papers. And here I am with my own diagnosis. And I'm like, well, uh, I'm not going to just do medicine. Like, I'm going to also take the power of placebo on my side. The issue with placebo is that you cannot, no one can give you a placebo because they are not allowed to give you a placebo, like in medicine, right? So then the question was, okay, well, if placebo is the mind, how do I get that power on my side? And so I had a coach, a cancer coach, that I loved, but she was amazing. She was like all into energy and tarot card and all this. And at one point, she's like, "Maybe you need to meet my shaman." I was like, "At this point, I'll do whatever." So I met this shaman, and I cannot explain to you, but I don't know, like somehow it seemed to work, and she seemed to understand what was going on in my life, and I was like, "Wow." Yeah, why have I been so close to that when you can just be very open-minded and be like, I don't know if it works, it doesn't work. Who cares? Like, I'm just gonna try and we'll see.
And what was that experience? Did you go to another country?
No,
Oh,
it was
here.
here. Yeah, it was
Okay.
so funny. So in my head, I was like, oh, I'm gonna see someone with like, feathers and like crazy. And no, she looks just like, like us. And originally she's from Colorado, moved to Portland. She looks absolutely normal. You would not,
Okay.
you would not think that, oh my goodness. But then, she closes her eyes and starts like reading, and you're like, whoa, like how does she know this? And so I asked her, she's like, I'm just reading it. And I'm like, wow, this makes zero sense. you know? And that's the thing. It's like there's so much you can't explain in medicine. And so I had to like, have my right brain, my left brain of like, okay, well, I cannot explain everything to my left brain. So my left brain being the analytic brain
Mm-hmm.
and my right brain being the emotional one. And I'm like constantly fighting. And at one point I was like, just live. It's okay. Like just live it through it. And it's okay. It's an experience.
Yeah, I mean, I'm very much so also into the placebo, and I heard you say you can't give someone a placebo,
A physician, I feel like it's really hard to say to someone, try this, it's gonna work for sure, right? Like, so, right, what is the first thing I did when I took this thing? I started looking at the ingredients because that is how I'm trained.
Mm-hmm.
It's like, okay, what are the ingredients?
Mm-hmm.
And you were saying, oh, it helps with anemia for
Mm-hmm.
women who have iron deficiency. I'm like, oh, well, yeah, that makes sense. There's liver.
Mm-hmm.
In the liver, there's a ton of iron because that's where you stock it, and so you reserve it, right? And so it's like, oh, this is my left brain, this is my analytic brain
Mm-hmm.
of, okay, now that makes sense. I would recommend this to patients who have iron deficiency. Makes total sense. And the issue is that and I've done 17 years of training, right? When you're so it's not brainwashed because that is not how we are being taught, but we are being taught a certain way, which is a way of look at the data, evidence-based medicine. If there's not evidence-based, then you cannot believe it. Like you should not believe it. And this is how our patients are coming to us technically, right? They're like, we want evidence-based medicine. And the problem is that we're losing the human piece of it, the mommy piece of it. I almost like the maternal piece of it, right? Or the paternal piece of it, which is very much maybe placebo. I don't know.
Yeah, I mean, and tribe vitamins specifically, I think it's a great example because you did like do the left brain analytical, and I probably explained it that way to you, knowing that you're a doctor.
Mm-hmm.
Now, for instance, if you were a Lakota shaman sitting across from
Yeah.
me, they might look at this and have a different type of placebo because they might be like, oh, the elk, the wapiti, and they might have a certain belief around the power of the elk. Like, oh, if I want to
Yes.
travel long distance with
Yeah.
my family, obviously I want to eat the elk meat. Oh, it's raw. Okay. Oh, obviously it's going to be the most nutritious. Oh, it's the liver. That's where the soul is stored.
Yes,
So
I
that I'm
love
going to get this
this. Yeah.
soul
Yeah.
I'm going to get the soul power or the soul charge of that elk. And they have their own placebo about that.
Yeah.
And one of the reasons I'm very hesitant about doctors is because I understand that I grew up in a culture that I was watching commercials as a child where like the person with the white lab coat is the most powerful person on earth. It's almost like a religion for a lot of people.
Yeah, I don't
That
know that that's true anymore, unfortunately.
yeah, after COVID, I think things have changed.
You think it's COVID? I think it was before.
Yeah, whatever the shift is.
Yeah.
But I do think a lot of people, like especially my parents' age, when someone tells them something, if they're a doctor, a medical doctor that has lots of years and lots of patients under their belt, I am just concerned about the power of those words.
Oh man, this is like, sorry. So fascinating. So it's fun. Like as you're saying this, there's two things that are coming in my mind. Number one, and this is where I'm stopping you, the powers of the words are huge. And a doctor that's telling you you're gonna not make it, huge power. A doctor that's telling you you're absolutely gonna make it, huge power. Even when we don't want it to have a power, it's incredibly powerful because there is at least our subconscious or telling us, well, no, they are right, and you want to make them right. And one of the reasons I opened the practice I opened and I let go of the institution I was at is that I realized that we were missing a huge opportunity for our patients, which is giving them hope. Like, I mean, I'm sorry, but like our whole job in medicine is to make our patients feel hopeful. If you remove that, there's no business in practicing medicine. So huge for me, like the power of words. And I try to tell this to my patients. Yesterday, actually, I had the husband of a patient who was telling me, what can I do? And I said, well, if you really want to do something, you can actually tell your wife every day that she is doing better and that you love her. And like, right, like he illuminated, right? And he was like, I absolutely believe that. And so you should have seen her face also, just getting less stress and like, oh wow, he believes in me, right? So that's powerful. And a doctor that believes in your healing is extremely powerful as well. I don't know that people believe doctors anymore.
I agree with that. You know, I mean, it depends on who you're, but like I think of my parents, and my parents have a lot of trust. Like I would say too much trust in doctors because,
Yeah.
for instance, like cholesterol, they have beliefs around cholesterol that now is like seems like the general ideas around cholesterol are shifting again. They're changing again.
Yeah.
But so this doctor at one point in their life may have gotten someone like my parents on statins, for instance, or some other kind of prescription that it may have not been what's best for them, but the doctor thought it at the time.
Maybe at the time, yeah.
And my parents will believe what the doctor says.
Yeah.
And this is concerning to me about medicine, Western
Well,
medicine.
Yeah, well, so I get you. And at the same time, I think you have to go with what data there is at the time. So if you really think about it, there's not a lot of options, right? So, I mean, there is options, but there are studies, right? So like as a rheumatologist, this is what I would tell my patient. I would like, well, we know that healing naturally is very hard because if we could heal naturally, you would not be in front of me right now, right? We also know that the treatments we have are extremely powerful to the point that a patient that would have rheumatoid arthritis, which is a very inflammatory condition that affects the joint, but also affects, all of their organs potentially, right? We now can put our patients into full remission. Before, there was not much of remission possible without actually causing a ton of damage. But we only had 2 or 3 treatments then. And if you didn't have treatment, you were very likely to deform your joint and to have a pretty horrible life, actually, with a ton of pain. Now we can get them in remission faster. The data we have is the data we have. And now we have like 20 years of data, or sometimes 30 years of data with biologics, for example. And all of the questions that our patients are asking, we can put those into clinical trial and get them answered in the long term, but it's going to take some time, right? But I think, like physicians right now, because we're not trusted inherently, just because we're doctors, we have to have this data and share this data with our patients, right? And so that's the only thing you can say is you can say, well, there is this or that study, and this is what it found. And it works for this type of patients. It probably will work for you because you are, like those
And
patients.
then there comes the placebo.
Well,
because
yeah,
some people,
because it's against placebo. Like those studies, usually
I
the
know,
good
but I'm
ones
saying
are
for the
against.
person that trusts in the doctor and they hear this from the doctor that trusts in these studies, then there's
Well,
potentially healing taking place right
totally,
there.
absolutely. So that's actually a very interesting point. What you're sharing, like what you're saying, is that you can do it two ways. You can take and this. I'm French. I'm a doctor from France, so I've been trained in France, right? And then I came to the US, where I was like, whoa, patients don't believe me just because I'm entering a room. So that was very surprising, and it was a lot in New York City and with a lot of African American. So then I learned about the history of African American and the doctors in this country.
Yeah.
And I was like, whoa,
Whoa.
I would not believe me either.
Yeah.
So then, you build the trust, and it does work, right? But you can do it with, here are all of the side effects that you potentially could have, and I'm not completely sure that this is going to work for you. In fact, it's only working in 40% of the time. So that's not super reassuring.
Mm-hmm.
Or there is this other way, which is like, look, the chances of you responding to this are extremely high. And yeah, here is what, I need to share when it comes to potential side effect, but that doesn't mean you're going to have it,
Mm-hmm.
right? And so there's those two ways of approaching this. And I personally, as a patient, I would rather have the second way, which is like, give me hope. Give me hope. We all know the moment I put something in my mouth, there is a potential risk, like even food, right?
Mm-hmm.
So I'm big on trying to get the power of hope on the side of my patients, because my goal is for them to be in full remission, get to full remission, and then back off of treatment. That's the goal. It's like as many treatment as you need to have a totally, completely normal life.
Yeah, and I do want to applaud you. You have a pretty amazingly authentic way of communicating, especially for a medical doctor.
Especially for, which is what we should all be, by the way, but
Yeah, well, I haven't gone to many doctors in a while, but I remember growing up and going to them and thinking, I was always like, I don't know, they just treat me like not like a human.
Yeah, I agree. I that's why and it's getting worse and worse. It's super annoying. Do you know that there are studies? It's really cool.
Mm-hmm.
They did some really good studies looking at the difference between women and men, doctor, and the outcome of their patients. So they first did it in medicine, where, the idea is that there's potentially more placebo effect.
Mm-hmm.
And woman physician, actually the patients of woman physician had a better outcome. Okay. And one of the reason anyone has experienced that, very often women have a tendency to ask questions about your life,
Be like more naturally nurturing.
Exactly. Yeah.
And there is something to be said if someone's going under a sincere health issue. I think they're craving their mom.
Yeah, actually. Oh, then that's funny, because I was just talking about this with a coach of mine. Yeah. So a mentor, actually. But all right, so there's that. And then they did the study, and I think it was published in the JAMA, which is a really big journal. It's very hard to get published. And they looked at the same type of study, but this time in surgery. Same outcome. If you have surgery from a woman, you have more chance of doing better. So I think it was 1 month, 3 months, and then 6 months.
Mm-hmm.
That's huge. And if that doesn't tell us that the power of humanity is healing, then I don't know what you need. There is a study from Harvard that's showing that also, that like the connection with your doctor is huge for healing. So it's interesting, the mom thing.
Yeah, well, I think what I'm maybe getting at here is how I'm aiming to inspire myself and others to potentially think about like being proactive about our placebos and
Yes,
like understanding that like, okay, if someone's going in and they have an injury, like, are you craving your mom or dad? First of all,
I
like,
love that.
are you like maybe a young girl might be craving their dad more, maybe an older man might be
Mm.
craving their mom more, and like realize that like, well, maybe you'll be better off if you're craving your mom. Maybe you'll be better off going maybe with an older woman doctor.
Yeah, never thought of that.
Yeah, and I just think it's a breaking normal angle of thinking
Yeah.
about healthcare.
I mean, I do love this idea that that there is this sort of maternal or father figure
Hmm.
in medicine, and I do think that that has a huge that has a huge potential impact. And so the mentor I'm talking about is a 85-year-old pediatrician from France. Actually, now he's 86, and he's so sharp. And he came out of the pediatric world and started just like healing his patient by just talking with them, right?
Hmm.
And so I was telling him, I was like, well, I don't know, maybe I should just coach at this point. And he's like, you should coach. I was like,
Hmm.
and he was telling me, Isabelle, what people need is a mom. And I was like, wait, what? And he's like, yeah, people need mom. Like that's what we are looking for when we're being coached. You need a mom that's gonna basically tell you, watch out, there's a stair here, or go, I'm behind you. And I thought that was really interesting because I never thought of me being the mom of my patients ever.
Hmm.
For me, I'm their partner, I'm their coach, I'm not their mom, right? And so that was a really interesting, and it just happened this morning. So it's been like in my mind right now. I'm like, wait, what? I'm a mom of my patients.
I think that's a good way to go about it, honestly, especially you being a mother.
But it's funny because I'm not embracing the motherhood
That's what I'm
as
wondering
much.
if
Yeah,
that's what's
it's
maybe.
weird. I'm embracing the coaching, and I'm for my kids. Um, I'm more of a coach to my kids. I don't know how to explain this, but
Okay.
for me, um, and because I had a lot of guilt as a mom, I think one of the things that has gotten me out of that guilt was this person who asked me one day, she's like, wait, so you're feeling guilty? And I was like, well, extremely guilty. She's like, what do you think of your kids? And at the time, they were 3 years old, right? And I was like, I think they are awesome. She's like, then you're a good mom. I was like, wait, what? She's like, yes, if you think that your kids are awesome, then you are a good mom. And I was like, wow, talk about removing the guilt of being a mom. Because I mean, like, if you're a mom, you're guilty. Even if you were the perfect mom, you would feel guilty because you would not be actually the perfect mom, because the perfect mom will create some issues in their kids, right? This is happening. But yeah, my motherhood, like the way I mother my kids is by making my kids very independent. So for me, it's not about the now, it's about who they are becoming.
Mhm.
And so I do understand that that's not necessarily how a lot of moms are. But I really have thought of like, who am I? And like, I cannot be this nurturing person, like with the boo boo and all this, like, oh, you have a boo boo. Or like when my kids learn how to walk, I remember like just clapping when they were falling because I was like, I do not want to be scared. So
Yes.
they would fall. And at one point, I remember my son, he would like fall and just clap on his own. It's
That's
hilarious.
so much better than like
It's
rushing. I've had a
hilarious.
few times when I like Davina, my daughter, fell, and then other people would be like, "Oh my God!"
Yeah,
And I'm like,
exactly.
"No, don't do that to her. Don't let her figure
Exactly.
that
Yeah.
out, please."
Yeah, exactly. And that's so
Yeah,
low.
yeah.
But it is funny because like the first reaction is like, no, are they gonna hurt themselves? And you're like, yay.
I like that placebo. That's a kind of a.
Yeah, exactly. It's a mindset. And that's the thing. I don't know that so I think, as I'm hearing you talk about placebo, I think that we're using this word and it has this connotation that's a little bit negative in medicine, when really it's about mindset. And it's about like, how can you turn this around?
Mhm.
And how can you say that this condition is a gift. Falling when you're learning how to walk is actually a gift. Because then you're like, oh, I'm learning. So what did I do right? What am I doing wrong? And then you try and try again until you actually know how to walk, right? And that same thing when you're learning how to bike and so on. And so it's this mindset of it's not about just erasing the quote unquote failures, which are never failures. It's not about erasing that. It's about using the experience to make something better.
Yeah, yes. Like there's no losing, there's only learning.
Yeah.
And I guess I think about people like that tell these stories about their doctor told them they only had 4 months to live. Do doctors say things like that
I
to
hate
people?
doctors who say that.
That's allowed.
Like literally,
that's legally
I cannot
allowed.
believe that they say that. I got really mad internally because I never actually confronted them. I sent one of my friend to a neurologist that I love. And I had seen the diagnosis. It was not looking good. It's a degenerative neurologic disorder. And she came back crying. And she's like, well, she gave me 2 years. And I got so mad because I was like, who are you to know the time that someone has?
That's what I'm saying.
And the issue is that for the 2 years coming, that like she made a prediction right. And at the end, when she decided to basically do a assisted, what do you call that? Assisted death or whatever it's called. I don't know. She basically said, well, she was right. And I was like, well, you made her right. And there was nothing I could say because I'm not a neurologist. There was nothing I could say to change her mind. And I'm absolutely certain that it went exactly that exact same time because it was told to her, you only have this amount of time. And I'm so mad, and there's nothing you can do except, I mean, I don't know. To me, it's a death sentence, and we are not allowed to do that. And I don't. There's nothing I can do in that case, right? Who am I to tell the doctors, like, who are you to do this? Who are you to do this? I can do it with my patient, which is like, you're going to do fine. And everyone is going to do fine, especially in rheumatology. I'm so mad at doctors who do that.
Yeah, well, I'm happy that you are mad about that, and
Yeah.
it's great to hear a doctor
This is
express
ridiculous.
frustration about it, and that's part of my frustration about the medical space, and that's why I'm like very careful about who especially when it comes to a dentist or a doctor who I allow potentially to project onto someone like my daughter. And it seems like we might be on the same page, but I am the same way. I'm like, who is anybody to project
Totally.
anything negative onto anybody, especially if you're on the power position.
100%.
And I mean, I do say if you're legally obliged to state the certain
We are
data,
not. That's BS.
But if
We're
I was
not.
going to be a doctor, and I took the MCATs,
Yeah.
I was pretty mad, and I thought about it. If I was going to be a doctor, the only thing I would allow, and I aim to live my life like this, but I aim to never project anything negative onto
Totally.
anyone. If I'm ever going to project anything, I aim to make it positive.
Totally. And then, okay, so here's the thing that's really funny, right? Why was I so into wanting placebo on my side when I got diagnosed? Because I had learned actually very early before. So I was at National Jewish, which is a lung hospital. So we did see a lot of interstitial lung disease. So the pulmonary, like the lung effects of inflammatory arthritis. So, right. So potentially the ones that are the most serious, right? So we saw a lot. And all of my patients were doing amazing. When I handed over my practice to my colleagues, 99% of my patients were in full remission. They were perfect, to the point that I told everyone, you're doing great. You don't have to come with me, right? I'm leaving, but you're doing great. I got you where you're supposed to get, and you're going to continue like this, right? And so I remember a discussion in the room with other of my doctor's colleagues, and they were like, oh yeah, we have death all of the time. I'm like, what do you mean? It's rheumatology. What do you mean you have death? She's like, yeah, I mean, as long, like, not, the other week, one of my patients died, and I was like, what do you mean? Like, this is rheumatologic disease. We don't cure them, but we put them in remission. And so then I'm hearing this from like 3 other colleagues, and I'm like, wait, what? Like, it never came into my mind that patients in rheumatology can die, ever. And suddenly I'm hearing it from other colleagues. And the difference is that I never believed, and I still don't believe, that a patient with a rheumatologic disorder should die, ever. No reason for it. They will die of other reason, not of my conditions, right? But somehow my other colleagues believe that they could die. So I think they give up hope. And because they give up hope, at one point, the patient also gives up, right? And that's the issue because, right? Like, so I had a patient, one of my latest patients at National Jewish had a transplant of her lungs.
Okay.
And she made a point of seeing me. She was perfect. So this is a woman that's 80. We are starting to doing transplant older and older and older because we're actually looking younger and younger. Okay. And we can do, perfect. No complication whatsoever, perfect. Having a normal life at high altitude. And you're like, well, there is a power, like medicine is very powerful, but we've got to try it. Like, if you're not giving the different options that we have in our really powerful medical world, then you're actually not offering the best to your patients. And that's how I see it. So, but it's interesting. It's the power of the words and the power of our trust in the healing of our patients is huge. And I don't know. I remember telling, I did a grand rounds and I shared my story, which is that I healed when so there's a lot of my colleagues that I couldn't continue to see during my healing journey because they were like, why are you still working? And I was like, because I love it. And also, as far as I know, I have more energy than you. Mm-hmm. So I continued to rock climb during chemo and all this. Like, I had a totally normal life. I was working less and having more fun in my life. Mm-hmm. That's probably the difference, right? But yeah, realizing that the power of, they thought that if it had been them, they would not have made it. They thought that if it had been them, they would go on an island. I was like, what's the fun in that? Like going in an island. That it's fun if I have my friends and family there, but otherwise there's no point. But yeah, it's. I think we have to remember that we're dealing with human beings, and that they are sometimes. I think they are not realizing that their job is to give hope, and so yeah.
Yeah, I'm happy we're having this conversation, and I trust that other people in the field are tuning in and considering it, because I'm just so fascinated by the medicine, and then maybe a shaman maybe it's like an unknown shamanism. It's because these doctors can be more powerful than like religious figures in certain people's lives. And if you're a doctor and you can tune in to like, oh my gosh, this patient is giving me too much trust almost. Yeah. I better be very careful here about how I communicate with this person.
So I've been thinking of this for so long, the power of the words. I was like reaching out. And I talked to a doctor that's also a hypnotherapist. And she's like, but it's because the moment you talk to someone, there is actually hypnosis. And I was like, wow, that's fascinating. And I think there is the possibility, and I don't know enough about hypnosis, but there is the possibility that the moment you're like, I'm here, I'm trusting this figure that knows more than me when it comes to my body. So you're actually disempowering the patient by doing that, because you want to empower a patient, not disempower them. But I wonder if that's why there's so much power into the words that a doctor can give. Mm-hmm. And so I think that doctors have to realize that and use it in their and the patient's benefit, instead of I don't really understand why they would be so negative. Like, because they are afraid that people are gonna like sue them. And maybe that's what it is. Like, that's what I'm wondering. Like in France, we're so much more positive most of the time, not all the time, but
Yeah, it's fascinating. I bet we're earlier than 47, but how are we doing on time?
Oh,
That's
look at that.
okay, 43, cool.
Well, you could stop at 47
No,
exactly.
I just have a tendency of knowing when it's 47 minutes. I figured we were a few minutes beforehand. I
That's
usually
awesome.
I try to keep them between 44 minutes and an hour and 11. That's like
Oh,
my
that's so
little
funny.
aim. I don't have much of another aim of being like letting what seems to want to come through us,
Yeah.
holding space for that. But I did bring those 10 questions,
Oh,
and
yeah.
this might have more to do with your practice and everything.
Let's do
How do
it.
people follow you? I mean, I'm sure people just listen to you for those 43 minutes and we're like, wow, I want to. Maybe they want to even be your patient.
Yeah.
What's the way for people to do that before I ask you some popcorn questions?
Yeah. So to become my patient, so yeah, the goal is full remission. So there's two goals there. One, figuring out what you have, which you wouldn't know the number of time. It's actually not a rheumatologic disorder, but actually an infection or diabetes or some other, rare condition. So there's the diagnostic piece, and then there's the putting you into remission if you have a rheumatologic condition. And so that's by going to my website and scheduling a discovery call. And that's UnabridgedMD.com. And then otherwise, all of I have a podcast on UnabridgedMD. I have a YouTube channel where I talk about rheumatology on a regular basis, at least once a week. If not, I try like 3-4 times a week. And it's called Rheumatology 101 by Dr. Isabelle Amigues. And I really love doing that, actually. I really love teaching rheumatology because I love it. And then all of the regular social media on UnabridgedMD. So that's
Awesome.
the way. Yeah.
Well, I definitely appreciate you being here, and that's been a theme of the show lately. Is there's been a lot of people that are experts in different health fields.
Nice.
And they're all breaking normal. And Yovel's introduced me to quite a few of them. So we got a good thing going on with Boulder and the Front Range healthcare and
Boulder.
breaking normal here, it seems like. All right. So the idea here is to answer these questions, just like real, like 30-second answers if you can.
Okay.
All right. So number one, what is the number one myth about rheumatology that's keeping people from remission?
Can you repeat that one?
What's the number one myth about rheumatology that's keeping people from remission?
Oh, wow. That it's okay to being just okay. So they are not pushing to full remission because they are doing better, but they're not perfect. And remission is perfect. So you should not be okay with just okay.
I like it.
Is that a myth?
I like it. All right, number two. How do you approach holistic care for autoimmune conditions differently?
Oh, wow. That's a 30-second question.
You can maybe one way.
So a 30-second answer would be by listening, actually, really by listening to the patient. What's their need? What's their lifestyle? What's their belief? What's the reason why they are not reaching remission? That's holistic. For me, it's really about a human experience. So that's my holistic way.
Awesome. What's one lab test most patients overlook that could change everything?
I don't think people overlook any autoimmune labs. But I would say I'm going to put it on the other way. I think that people and physician and nurse practitioners and advanced practitioners, so physician assistant, are falsely reassured by negative workup. And then you absolutely can have a rheumatologic condition that's very inflammatory with absolutely normal labs.
That's interesting. Wow. Gout gets so much misinformation. What's the biggest misconception you hear?
The biggest one for me would be that people think that they can have that they cannot be in full remission from it. So like they live with gout and they're okay to live with gout when really we have like super good treatment to get them to not have to deal with this ever again and have a totally normal, like whatever they want to eat. I mean, in general, I try to help them eat better, but the truth is that we have incredibly good medications and it doesn't have to be crazy, like fancy.
Okay. Wow. What mindset shift do people need for long-term autoimmune healing?
Oh, wow. So I have so many in this one, but I think the most, as someone that has worked in rheumatology for more than 20 years now, I think the biggest one would be to listen to your body and to being very kind. One of the thing that I find often is that they're like, "Oh, I'm so upset," right? Like they're so upset with their bodies instead of being very open-minded and pausing and just asking, "What do you need right now? What does my body need right now?" To me, that would be the biggest one. There's so much more, but in 30 seconds, that would be the biggest one.
Okay, thank you. I like these answers. Thanks.
Good. Okay.
Man, this question is a little odd for me, but let's see if I can figure out how I'm going to ask it. What's like one of the most surprising stories you've heard in your free consultations? Or 90, I don't know if they're free or not, but your 90-minute consultations.
Oh, okay. Sorry. My 90 or my free consultation?
Either or. Is there any like stories you're like, this shocked you?
Shock me. I don't know. I have like so many good stories. Like I could, write a book on good stories, but like in the free one day, I think I figured out what was going on by just listening. So I had like a 15 minutes discovery call. And basically, this patient had like joint pain, and suddenly I'm like, hold on, like, didn't you start this medication recently? Like, what have you started? And she's like, yeah, I started this new medication. And I'm like, when did this happen? She's like, oh my goodness, it happened just after. I was like, yeah, stop it and let's see. And I was like, I don't think you need me. So she stopped it. She actually let me know she was perfect.
Wow.
So that was really fun because it was like, 15 minutes, like figuring out what it is. That was kind of fun. I think the best one recently was this patient that had seen 15 other providers and comes to me, and his primary care physician was like, just can you put him on biologic? So it's a very like immunosuppressive drug. And like he was being given steroids. And I told him like, something's off. Like this is not rheumatologic. This is something off. And he had already seen, like he had a rash, he had joint pain, and was not doing well. Like he had like very, very fatigue. So he had joint pain, fatigue, and a rash, a skin rash. And he had already seen a dermatologist. And I said, I think you need more biopsies on this skin rash. And I was like, this is, I think, something else. And fair enough, it was syphilis.
Wow.
It was really interesting.
Wow. Does that rash show up on
it's one of the mimicry. But
wow.
What's really cool, you're making that face, but I got super excited.
You found out what was going on. I haven't not thought about
for me, it was
much.
The coolest thing, because what did I tell him? I said, this is the reason you haven't gotten better. It's because we keep giving you immunosuppression instead of giving you antibiotics. But here's the thing. The moment we give you antibiotics, we're going to actually cure you versus put you in remission. It's actually curing you. So he didn't need my help. I mean, he needed my help for those diagnosis moment, but then he didn't need my help after. So that's the latest one. I have like a ton. Like I made a diagnosis of diabetes in a young patient that also saw like, I don't know how many people. And I was like, wow, people don't take the time. Like it annoys me when I'm making a diagnosis that's not in my field. Because I'm like, yeah, this is great. I'm really good in rheumatology. I'm a very good doctor, no question. But still, like, I wish they didn't have to come to see me, because then that would mean that, they are not bad. Like, I would hope that. But I think it's a system issue, right? I'm not upset at the physician per se. I think it's a system issue. Yeah.
Yeah. Wow. Okay. How do you balance tech diagnostics with intuition and deep listening?
Oh, sweet. I love that one. That's probably my favorite question that you've asked. So I think I have a lot of training. And so I do ask, like I do everything medical. And I make sure not to forget. I try not to forget any sort of diagnosis that's, getting my way. And I trust my intuition. So when I was telling you the story of the patient that ultimately had syphilis, or I had another patient, ultimately it was cancer, again, I got super excited because we're going to cure him versus remission, right? And he's doing super good, by the way.
Nice.
Both of them, really. And that's my intuition then. It's like something's off. Something's off. And so then you go deeper, and this patient with the cancer diagnosis, he had already all the cancer screening. And I was like, something's off. We're going to go and we're going to do deeper. And fair enough, lymph node biopsied. Then that was cancer. Super good outcome. Like cancer doesn't mean that you're going to die, right?
Yeah.
And so, yeah, it's like, it's this intuition of like, something is off. This doesn't fit this rheumatologic thing. And it's really cool. And sometimes I'll ask for second opinion at Hopkins and something, and I'm like, something's off. And then fair enough, there's always something. It's like, I mean, not always, because it's not happened to me that often, but yeah, like they don't blow me up. They're like, oh yeah, you were right. It's not just dermatomyositis. There's also myasthenia gravis, which is a neurologic condition. And it's cool because then you can get to full remission. Again, the goal is full remission, having a normal life. Right. So it's not like, oh my goodness, be worried about this. No, it's like, how do I get you to full remission? Yeah.
Awesome. What's your number one tip for someone in chronic pain who's lost hope?
Come and see me now. No, honestly, yeah, it's come to see me. If there is pain, there is hope. If there is pain, there's hope, because pain is only a reaction of your human body to tell you that there's something wrong. So we need to figure out what's wrong. And once we figure out what's wrong, then we can heal it. And there are some patients who are on narcotics, not realizing that they are in pain because they are on narcotics. And so one of the patients that I treated recently, we got her off of narcotics. After, I think she had been on narcotics for 5 years. She got off of narcotics by going on ketamine. I don't give ketamine, but I referred her.
Okay.
And she got ketamine, and she doesn't need narcotics. And she's already started decreasing the ketamine as well.
Okay.
And so, yeah, like we figured out, so she definitely had some autoinflammatory syndrome that we took care of. And then we removed the narcotics.
Okay.
Yeah. So, yeah.
Wow. Okay. Let's see.
Are you getting more like, are you having more trust in the medical system now? Like a medical way?
I think I feel like I'm getting a better grasp on some of it.
Okay, cool.
Yeah.
Yeah, because it's not one or the other. It's both.
Yeah. Now, we got a couple more.
Okay.
What's the most powerful lifestyle hack to reduce joint inflammation now?
Food.
Oh,
yeah. And it's not the one that I would want to say, but it is food. Whatever we eat can be either pro-inflammatory or anti-inflammatory.
Is that on an individual basis, in your opinion, or is there some things that are obviously inflammatory?
It's super damn obvious. Like, unfortunately, it's super damn obvious. We eat a ton of processed food. If you ask everyone right now, they'll all tell you that the day that they stop gluten, they feel better. I'm one of them, and I'm French, and I love bread. Like, bread is my religion. Bread, cheese, and wine. Out of this, I cannot really have if I want to be healthy or healthier. And so, yeah, I think that eating a ton of veggies, a ton of fruits, super, super important, and grains more than gluten. That is very anti-inflammatory. And it's actually proven now more than ever.
Awesome. All right. Let's see. We might got one more here.
You sound very excited.
What's one simple behavioral tweak that can turbocharge autoimmune remission? It might be the same answer as before.
You said lifestyle, or you said
like a behavioral tweak. Something they can.
Honestly, tuberculosis, I think it's visualization.
Visualization.
It's visualize yourself healthy. Yeah, that one would be, and it's kind of like in the same verb that, the power of the words, power of who you're with. Are you going to believe? Do you actually believe that you can have remission? And if you do not believe that, you cannot have it, because you're going to be right. But if you believe it, you're going to be right too. So, yeah.
Oh man, that might be that. I don't know if that's like a Henry Ford quote or who it's quoted by so many people, but like whether you think you can or you think you can't, you're right.
You're right. Yeah.
That I feel like should be a major part of medical school. Is like
Yeah.
just diving into that philosophy of what that actually means for the person studying it and potentially for all your patients.
Yeah. And I don't know that we have right now created that. Like I was ranting this morning about the fact that we have a training in how to bill and how to write our notes so that we can bill properly on insurance and get, you know, the maximum money that you can get versus nothing in nutrition and nothing on mindset.
Yeah,
Nothing.
this is what I'm thinking. Because
Yeah.
if this was a major part of medical school, then there would be no doctors telling people how long they have to
That's
live.
ridiculous. Yeah, I'm so freaking pissed at that. No, that is super annoying. Yeah. And those doctors,
Unless you were so cued in and you're like, okay, this person, we know about this person, and they'll do the opposite. If we tell them so, like there is a wisdom in that because some people are driven by, like I've heard stories also, like the doctor told me this and I said, fuck that.
well, but that's the only way that they can get out of it. That's the only way. It's the people who are saying fuck that. Sorry for that word.
Yeah.
But literally, the problem is that if you don't have the life energy in you, you are literally letting that decide.
Yeah, and that's where this is such an important conversation. Such an important
Absolutely.
conversation.
I'm glad you shared that and we started talking about that. But yeah, it's a big pet peeve of mine. It's like, who are you? And I tell the patient, I'm like, don't look at internet because it's backwards. If I had looked, so my twins were very, very preemie. They were 6 month old, 6 month, whatever, like it's called. A full
Premature.
trimester premature. So they
Okay,
were
wow.
25 weeks.
Wow.
Yeah, it's crazy because normally it's 38 or to 42 weeks, right? So they were 25. So their skin was translucent. They couldn't, we couldn't see their eyes, like because it was not formed. And if you were to look at the data at the time, they were going to have cognitive issues, delayed. They would have had like a ton of complications. And I was like, I am not looking at this. This is backwards. I'm not looking at this because this is like, to do this, you need 10 years. And so the medical field is already advanced by the time you finish that study. Same thing in oncology, same thing in rheumatology. So it's good for a doctor to have an idea of, what's the outcome right now. Should we resuscitate? Should we keep in the NICU a kid that's 25 weaker or not, right? And until they had this data, they were not doing it. But now that they have this data, they're like, yeah, they are doing okay. And now we're going to push, right? And I think that's the same thing. It's important for a physician to have this data, but it's not individualized. Like we can't treat a patient based on this. Not possible. And so we're always behind in the field of medicine if we look at internet. Always. Internet or, the studies. We're always behind.
Wow, that is a major point. That's another major thing for us to consider. Thank you for that.
Yeah.
Thank you for all of this. Do you have any questions for me?
No, no. What are you believing a little bit more the Western medicine world?
Oh well, so I believe in what I believe in are certain doctors.
Yeah, that's great. Yeah.
Yeah, the field as a whole, I think it's about as broken as the education system as a whole, but I believe in certain teachers.
Yeah, I like that actually.
And I believe in certain schools. And maybe I'll find, maybe I'll believe in, but you have your own practice. That's, I
do,
respect. Like if I did go past the MCATs, I think I would have to do it that way as well.
Yeah. Makes sense.
So thanks for breaking normal and doing that. And thank you for this. This is awesome. I bet your patients have a ball with you.
I love them.
Yeah.
And if I love them, they must love me somehow, right?
Yeah.
I love them. It's like the best thing I've ever done in my life. I love it. Yeah, it's just like honestly, just having like so much pleasure of helping people, being the best of them. I feel like a coach. I don't even feel like a physician. It's cool.
That's awesome.
Yeah, it's really cool.
Thank you all. Keep
right.
breaking normal. Leave this review, and hey, if you have any more questions, reach out to her. post them below wherever you're watching this. Keep breaking normal, y'all.
Well, thanks again for tuning into the UnabridgedMD podcast. Be sure to subscribe so you can be notified when the next episode is up. And as always, if you think that this would be helpful for a friend or a family member, please share. Wishing you wellness. Until next time, take care.